We're here at Pure Plastic Surgery, and it's Hump Day with Dr. Earle. It's one of my favorite days because I get to spend some time with you guys, hopefully answering lots of your questions, making sure that you're comfortable with this journey, with this process that you're about to embark on. And so today I wanted to talk a little bit about breast surgery and some of the different things that we see and some of the different things that we can do. So I was thinking we could start there, and then of course I'll be happy to kind of take all your questions after that. So I wanted to talk initially about what we call breast ptosis or breast droopiness, okay? So there's different degrees of ptosis. There's actually 3 degrees of ptosis, 1, 2, and 3. So this is 1, that's 2, and 3. And then of course there's no ptosis. That's someone who has a kind of a very youthful, very kind of perky breast. Typically it's a smaller breast, and so that would be considered no ptosis. So if the nipple position is actually above this line here is what we call the inframammary fold. So the inframammary fold is here. If you have your nipple position above that inframammary fold, then you have no ptosis. Okay, and those typically a patient that's a good candidate for a breast augmentation. Okay, so those are the typically smaller breasts, you know, A cup, B cup type breasts, and that's a straight aug. Okay, now if your nipple position is at that line at the inframammary fold, that's called the grade 1 ptosis, okay? So depending on the patient, some of those patients can actually get away with a breast aug and not need any sort of lift, especially if they're willing to accept a bigger implant, okay? So if they're willing to accept a little bit of a bigger implant, that will give them enough of a lift that they don't need an actual breast lift procedure, okay? And then there's some other patients may do well with just what we call a donut type of lift, okay? Or circumareolar mastopexy. It's kind of like a fancy name, but it's what we call the donut lift, okay? So either no lift or a donut lift for the grade 1 ptosis.
Is there a way to lift the breast by just using implants?
So like I said, so if you have a grade 1 ptosis and you're willing to accept a little bit of a bigger implant, then yes, you can get enough of a lift there that you don't need an actual kind of surgical lift, okay?
For moms that were breastfeeding, how long after can you get implants?
So if you're breastfeeding, you want to stop breastfeeding for 6 months, at least 6 months before undergoing a breast surgery, okay? So it's not from the time that the baby is born, it's from the time that you actually stop breastfeeding, and then you got to give it 6 months, and then it's okay to do surgery. If you try to do surgery anytime before that, the milk ducts are still open, and that actually increases your chance of potential complications after the surgery, including infection. And so you don't want to do it too soon. The other thing is that the breast is going to change. So the breast is going to typically, become smaller after you stop breastfeeding. And so then if you do it too soon, you're not going to have a good long-term result because you don't know exactly how many changes your breast is going to undergo, in the interim. Okay.
Do patients have options to do high profile versus ultra high profile silicone implants?
Yeah, so we'll talk to that, we'll talk about that, but yeah, of course, that, the difference between a high profile and ultra high profile usually has to do with patient preference. So if they want that really kind of augmented, kind of top up look, then that's typically what an ultra high profile implant would give you. If you want a little bit less, a little bit more of a subtle look, then you do the full profile. Then you want more of a natural look, then we're talking about a moderate profile implant there.
And how long do your implants last?
So that's the great news. So nowadays, and I have the sample implants here. You can see that these are Dr.Earle. That's the company that I use. And these are what people typically call the gummy bear type silicone implants, okay? So they're silicone implants, but they're gummy bear type silicone, which is what's called a highly cohesive gel. Highly cohesive means that it's not like a liquid gel. If you were to slice this implant in half, the silicone wouldn't just kind of like ooze out, okay? It would actually retain its shape. So another word for it is form stable. The great thing about these implants is that there's no kind of expiration date, okay? They actually have a lifetime warranty because they're supposed to last you, a very, very long time. And if it's been 15, 20 years and you've had no issues with them whatsoever, there's no need to change them at that time. They're actually made to be really, really strong, and I'm trying to break it here, and I can't. I think one day I'm going to do this in front of a patient, it's going to pop, but for now I haven't been able to because they're really, really tough, and so they're made to last a long, long time. Okay? So that's great. So we talked about grade 1 ptosis. Then there's grade 2 ptosis. Grade 2 ptosis is when the nipple position is below that line, below the inframammary fold, but it's not the lowest part of the breast. It's not at the lowest part of the breast. That's a grade 2 ptosis there. Typically for these patients, a lot of these patients, we can do what's called a vertical or lollipop type of lift, okay? We typically have to increase, lift the nipple position by about 3 to 6 centimeters, and a lot of those patients do well with the vertical or lollipop type of lift, where the scar, if this is the breast here, the scar literally looks like a lollipop like that, okay? All right, and then for the grade 3 ptosis, okay, that's the most droopy. Those are the breasts where the nipple position is the lowest point of the breast and certainly below that inframammary fold. And for these patients, an anchor lift is what's needed. So that's this scar pattern here where it goes around the nipple, down to the bottom of the breast, and then underneath the breast, the breast crease area. Okay, so I know there's some patients do present with like a grade 3 ptosis and ask me if they can only have an implant, and I tell them that unfortunately absolutely not. There's no way that an implant will look good because the implant's going to sit high, the breast is going to still sit low, and it's just going to look terrible really. You're just going to look like having a ball on top of a breast, and you don't want that. You definitely need a lift for that. So that's why it's very, very important to send good photos. If you're sending breast photos, send the front view and certainly the 2 side views, okay? And sometimes it's even good to send an oblique view because that way it can really take a look at everything and determine what most likely the type of lift that you're going to need. But we can always we always do finalize the decision when you actually come here, because then I can really take the measurements and then be really, really accurate as to what is going to be the best operation for you.
How long after a BBL and a tummy tuck can your breast be done?
So I don't know if you meant it together. I don't do tummy tuck and BBL together, but from either surgery, basically you can come back and do the breast surgery at 3 to 4 months. So if you have a BBL and you want to do the breast, 3 to 4 months. If you had a tummy tuck, we can usually do the breast actually at that same time. So if you're doing a tummy tuck and you're thinking about the breast, I would combine that into one surgery. That's what we typically call the mommy makeover, right? So the mommy makeover involves some sort of breast surgery and a tummy tuck with the muscle repair and the liposuction to the flanks. It's a very, very common surgery. We get a lot of things done, and I would highly recommend to just do all that together. Mm-hmm.
Is it beneficial for your patients to try the Rice test method?
Do
you know what that is?
Yeah, of course. I've heard about the Rice test method. So basically what it is that you put rice like in some sort of sock or something similar to that. You then put that in a bra, you see how you look, and then you find a size that you like, and then you kind of measure the volume of that rice, and that'll give you an approximate measurement of the volume of the implant that you want. And so if you have the ability to do so and you get the math correct, then sure, that's a way to kind of estimate things. But remember, the one thing that the Rice method does not do is it does not take your measurements and does not know your anatomy. So maybe it can give you a rough idea, but really that's going to be finalized when I can actually see you in person. I can take all your measurements, I can look at your anatomy, and I can combine that with your desires in a process that we call smart aesthetics, where we combine your subjective desires with your objective data, put that together along with my experience as a plastic surgeon, not only as a cosmetic plastic surgeon, but as a reconstructive plastic surgeon, to come up with the best plan in order to give you, beautiful, long-lasting results.